Hello, everyone. I would like to welcome all of you to our session on digital health with Opportunities New Brunswick. As we all know, this is a very crucial time to keep the dialogue ongoing in the digital health and innovation sector. The pandemic has exposed the gaps where there are critical requirements for cutting edge tech tools and innovation. And consumers are increasingly in need of wearable gadgets, mobile health apps, and artificial intelligence, which consists of robotic carriers, sensors, and so on. Lifestyle enhancement to medical and emergency healthcare can only progress with the transition and adoption of innovation in the healthcare sector. Looking at the long-term development of digital tools, which would allow patients to have greater control over their health outcomes, it would be great to learn what the province of New Brunswick has to offer. The province is now seeing unprecedented spending on digital health, which means opportunities for companies. The Canadian government invested $75 million in the Healthy Seniors Pilot Project, which will fund a wide range of applied research projects. Additional pan-Canadian partnerships have made the province well positioned to bring even more world-class digital health companies to the region. And I think we'll learn a little more from our colleagues and our friends and guests who are here with us today from Opportunities New Brunswick. So I would now like to invite Tandy Dempsey, who is representing New Brunswick, to present what the attractive schemes are available for Indian-based businesses in the innovation and life sciences sectors. And Tandy, before I hand it to you, I'd also like to warmly welcome Dan Martin, who is here with us. And I think Dan will probably speak once Tandy has said her bit. Over to you, Tandy.
Hi, good morning, everybody. I'm Tandy Dempsey. So I am the Business Development Executive for Digital Health, the team lead. So my presentation will be available after, should you wish to kind of look at any of the things we talked about. My contact information is on the last slide. So any companies that have an interest of moving to New Brunswick in the digital health sector, you can get a hold of me through email, and we can continue the conversation after this presentation. I'm going to start and share my screen. So New Brunswick is Canada's living lab for digital health innovation. So I'll be talking to you about the digital health ecosystem that we have here in New Brunswick, and followed by my colleague Dan Martin will be presenting on our client engagement piece and how we can help you transition into New Brunswick faster. So New Brunswick itself is on the east coast of Canada. The population is just under 782,000 people. However, within a 1,000-kilometer radius, we have over 55 million consumers. So if you are looking to do business in a small area but have access to millions of consumers, New Brunswick is the ideal place. We are fairly close to Montreal and Toronto, which are some of the bigger cities in Canada. We are also neighbors, of course, to the United States and very close to Boston and New York City. So also another reason to kind of look at New Brunswick, if you're looking to do business with Western Europe and you also want to do business with North America, South America, New Brunswick provides the ideal time zone to kind of handle both of those in the same day. So for example, this morning right here, it's 9 a.m. So I could be talking to people all through Europe, even as far over as India. And then this afternoon, I could be conducting business with Western Canada, Western United States down into South America. So the New Brunswick Advantage, this is the 4 pillars that we talk about when we're talking about all of our different sectors, but it definitely applies to digital health as well. So New Brunswick, some of the advantages include our agility. We have a small population, but that allows us to get things done a lot quicker. It allows us to be connected, to have an ecosystem that is accessible. We have our people and our talent, which Dan Martin is going to be covering a lot more in this section. We have our innovation and our infrastructure. So our momentum in the digital health space is a result of support from all corners, provincial and federal governments, our 2 health authorities, economic development agencies, and industry leaders. We have an aging population, but this provides an ideal place to innovate in the healthcare space. We're a microcosm of Canada's makeup. So New Brunswick provides the ability to work with both urban and rural regions, Indigenous communities, and we have a bilingual population, English and French. The Health and Technology District is one of the large initiatives that's going on in the digital health sector right now in New Brunswick. So this is an innovation collision space. It's going to be in 3 phases, and the first building is set to start in 2022. If you want to look at an example of what this could be like, there is currently a Health and Technology District, Surrey, BC, which is SURREY. It's the same construction company, the Lark Group, that has designed this district. So you could see an example of the type of companies that are in this district in BC. In New Brunswick, this is the second part of the Health and Technology District that they've looked to build, and we already had a large portion of what they needed to start in Surrey. The building itself is right next to the largest hospital in New Brunswick, which is the St. John Regional Hospital, home of the NB Heart program, and 2 different medical schools feed into this hospital, which would be Sherbrooke Medical School out of Quebec, as well as Dalhousie Medical School out of Halifax, Nova Scotia. It is on university land, so the University of New Brunswick, and they also have a Bachelor of Health program, and then these different buildings that'll be the innovation collision space. So the tenants that'll be in these buildings will include startups, they will include mid-sized companies, and they will include large multinational companies. There will be healthcare providers, there will be labs, and there will be some academia. And all of this together will provide the collision space for the Health and Technology District. So if you are looking to move your business, it could be soon in the next couple of months, but also, as I said, this is a 3-phase project. So up until 10 years, this may be a space where you may look to talk more about and look at the tenant agreements here. Another one of the big initiatives that's going on in New Brunswick is called the CAN Health Atlantic Hub. So the CAN Health network itself incorporates all of Canada. It started with Ontario, then it moved to the west, and the CAN Health Atlantic portion just made the announcement in May of this year. So what this is trying to do is really speed up the procurement process between companies and hospitals or healthcare buyers. So the actual edges, and that would be any of the healthcare buyers, a lot of them being the hospitals themselves, will put out something that looks like an RFP, but it's called a call to innovation. Companies can then look at these calls to innovation, see if they can provide the solution. Once they are chosen, that is the only RFP that they would have to do. The edge, so the hospital, would then work with them for the solution to provide for themselves, but then it's the hospital themselves that is then responsible to promote this company to first would be the rest of the Atlantic Canada region, but then across Canada to all the other networks. So the company, once they've got the one solution, they do not have to go through the RFP process. So what could start out as a small company and you obtain one small contract could end up being 10, 11 contracts very quickly across the country. So the one thing for this is you do have to be incorporated in Canada. But this does not mean you have to be incorporated in Canada for years and years. So if this is something that you're looking to, this program is just starting right now. So what else is going on with digital health in New Brunswick? And if you want to kind of see if you'd fit in, what's available. One of the major initiatives that we have here is to help with solutions for an aging population. So it was mentioned about the $75 million that was put into the Healthy Seniors Pilot Project. So that's just an example of how government is also supporting of looking for solutions for the aging population. So if you are a company that has some of these solutions that can keep seniors in their home longer, that can help with caregivers, that can help reduce costs of healthcare, New Brunswick may be the place that you'd be looking to continue working. Precision medicine is another big part that's going on right now in New Brunswick. The first purpose-built precision medicine center in Canada is built in Moncton, New Brunswick. This is a collaboration between the Atlantic Cancer Research Institute and the University of Moncton. So this space conducts animal clinical trials, and it's also set up for patient clinical trials. And they focus on developing new diagnostic tools and therapeutics that are patient-specific. So they're looking at unique molecular biomarkers and what options would be most effective for each individual patient. The center itself also offers space for rent for existing and startup companies. Precision medicine also incorporates anything to do with looking at the person as an individual and how they can be treated, as opposed to looking at a disease state. Number 3, biometric markers. An example of this, we have a company that started in New Brunswick, and they are called Peekamole. And they have identified a biomarker for early stage lung cancer. Then they developed a test tube that a person can use breath analysis. So you're blowing into this tube. The tube is then analyzed in the lab for the biomarker that they identified, and it can be looked at for early stage lung cancer. So, I'm sure everybody on this call understands how important in any type of cancer, detecting early provides a lot more treatment options. So there's biomarkers are very they're kind of a hot topic right now. They've identified biomarkers for different types of Parkinson's, for early stage Alzheimer's, for dementia. And the earlier we can identify patients, the earlier they can start treatment. So that's another area where New Brunswick has kind of started looking at different research products. Number 4, 3D medical printing. New Brunswick has done very well in 3D printing, but we haven't got into medical printing yet. So this is just one step further. So far we have concentrated on the energy sector, the manufacturing sector, and the food and beverage sector. So we have the talent that is very familiar with 3D medical printing. The University of New Brunswick has an engineering program that does a lot around 3D printing. So next we're looking for a company that is interested in 3D medical printing and to kind of start that type of industry around here. Number 5, wearables. This is a hot topic worldwide right now. What started off as lifestyle tools, our Fitbits, our Apple Watches, has now turned more towards the medical industry and what we can do with these wearables and what type of markers we can pick up. So for example, virtual reality has many different types of eyewear out there that measures ocular metrics. And from that data, they can look at possibly a patient and how they progress through dementia. There's different types of earbuds right now that take signals from our auditory system and can analyze different diseases as well there. There are clothing that's available to take our sweat and different metrics that they can pick up from there. And then, of course, there's also sneakers that look at different things of gait. So there's many different wearables that are currently being designed, but it's not just looking at the wearables, it's looking at how do we store all that data? What do we do with that data? And then the connections between all the digital technologies in order to connect these wearables to the cloud and how we go about using it. Number 6, research. So we have the Atlantic Cancer Research Institute is in New Brunswick. This is a private nonprofit organization founded in 1998. The scientists are working with partners in Canada and around the world to impact patient care via the pursuit of research in the area of liquid biopsy and targeted treatment. So the research team has experience in genomics, molecular biology, cell biology, immunology, bioinformatics, pathology, mass spectrometry, in vitro and in vivo testing. The New Brunswick Health Research Foundation has a mandate to coordinate, support, and promote health research in New Brunswick. And then also New Brunswick Institute for Research Data. That is the data steward for the New Brunswick Health Administration and Data. So it's also now a hot topic of how do we collect all of this data that is being used from all these different digital health devices. New Brunswick's been doing this for quite a while with the data steward, the NBIRDT. They have also developed a new evaluation program. So they are the ones that are going to be evaluating all these programs that are in the Healthy Senior Pilot Project that have been given money to see kind of what the output that they have produced from this project. So that brings us right into from research to health metrics, and that is all the data information that we were talking about. New Brunswick has done very well in our cybersecurity ecosystem. We are one of the best in Canada, probably one of the best in the world in cybersecurity. So we are a safe place to do business, and it makes sense that when we're now kind of concentrating on health privacy, health data, that New Brunswick is also somewhere where we develop this ecosystem. And number 8, last, definitely not least, telehealth, virtual health. This has blown up worldwide because of the pandemic. But I think everywhere has their own system of what virtual health looks like. In Canada alone, almost every province has a different virtual care platform that was put in place quickly in order to help during the pandemic. So patients wouldn't have to be physically going to the hospital, but they could still get care online. So the virtual care is definitely still changing. We don't know what it's going to look like in a year from now, but it's something that's been very prominent because of COVID-19. So I had talked about a few of the different precision medicine health technology districts. So this is just the slide if you wanted to kind of refer back to some of those life science assets that I had talked about in the program. You can look at this slide. So a little bit about New Brunswick with the COVID-19 pandemic. The consensus seems to be that the success of New Brunswick has been viewed with envy in other parts of Canada and around the world. So Kevin Wilson, he's an epidemiologist from Halifax, Nova Scotia, believes the willingness of public officials to lock down quickly and keep a lid on transmission was key. So the region outperformed other areas with similar rural makeups. We had faster, stricter border closures and lockdowns. So this distinguished Atlantic Canada from other parts of the country. So the good news story here is that as of Friday midnight, we will no longer have any restrictions in New Brunswick. We currently only have 6 cases in the whole province. Over 80% of our population has received the 2 doses of the vaccine, and over 60% of our population has received 1 dose. We cannot present anything with New Brunswick without talking about the quality of life that we have here. So some of the pictures on the bottom, that's just not what we do on vacation. That's what you can do after work. New Brunswick is surrounded by water. So people love getting out on their paddle boats and their kayaks and their canoes, motorboats, sailboats. It's accessible. People can afford waterfront property here. They can afford cottages, lakefront property. But if you're more of a person who likes the woods, we also have a lot of the undeveloped land, a lot of hiking trails, family camping. And then if you enjoy the city life, we have an immense number of different restaurants, bars, city life as well. So the idea here in New Brunswick is that we work hard, but we also play hard, and you have the time to do both. We aren't stuck in traffic. We are basically, we're picking up our family. You can bring your kids. They can, be a part of sports. They can be in hobbies. They can be in a STEM program. New Brunswick really is a nice place to live. And it was rated A+ on life satisfaction and actually higher than Switzerland. and it's in the top 25 places to live in Canada, to live and work. And then there's also cost savings. So compare to other jurisdictions, New Brunswick is about 1/4 of the cost to buy a home than it is in Vancouver, which is the west coast of Canada. And it's also about 4.1 times higher to buy a home in Toronto than it would be in New Brunswick. So there are great things happening in New Brunswick, but we have room for you. So if you are interested further, this is my contact information. Opportunities New Brunswick kind of acts as your concierge to come to New Brunswick to set up and to do business here. So I'm going to pass it over to my colleague, Dan Martin, and he's going to continue with the presentation.
Great, thank you, Tandy. I will just prepare to share mine as well. Hopefully everyone can see that now. Okay. It's strangely not showing up on my screen. Even though
no, Dan, we can see it clearly.
Okay. Wonderful. Okay. Thank you. So good morning, everyone, and I guess good evening just as well, but morning time here for us in New Brunswick. So wonderful to be with everyone here today, and thank you for your time. Really looking forward to the discussion with you folks here and to the Q&A afterwards as well. My name is Dan Martin. I am the manager of our client engagement team at Opportunities New Brunswick. So Tandy, as she's presented here this morning, a business development executive with a focus on digital health. My team are sort of your regional experts and your regional supports as you make the decision to come into New Brunswick. So certainly New Brunswick, a relatively small province, but once you've made the decision to come to the province, you're not just picking New Brunswick, you're picking a certain region. So are you going to be in the northern part of the province, the east, the west, the south, whatever it may be? There are different supports available in each of our jurisdictions, and it's our job to make sure that you are able to access and able to leverage all of what the province has to offer businesses as they set up in New Brunswick. So really, this is about becoming an extension of your team. And I want to do that sort of as you plan your move into New Brunswick, before you arrive, and then for the duration of your time here in the province. We will ultimately build sort of a fully customizable service that's designed to ensure your success in the province. Prior to actually coming into New Brunswick, we would have multiple meetings with you and with your team to come up with a strategy related to client engagement. And client engagement for us can take many forms, but really it's so that you've got boots on the ground, someone to act as a bit of a GPS service as you enter New Brunswick. We have representation around the province, so this is a fully customizable, high-touch, white glove type of service that we want to make sure we extend to your team. And again, if you've not done business in the province, or if you're not from New Brunswick, there may be nuances and supports that exist that you wouldn't be aware of without working with our team. But we're there to ensure that you get a world-class experience, and all of the support that's available to businesses already in the province will ensure that those are there for you. We also will want to make sure that the brand and scope of the organization is known to all the relevant parties in New Brunswick long before you get here, and again during your time of business in the province. We think that there's a great deal that can be done to ensure that you're landing in the province, you're welcoming, your ability to get on the ground and running as soon as possible. We can take that over for you in partnership to ensure that you've got a smooth landing, smooth opening in the province. So as client engagement specialists, we are really a number of things for our business partners. We would act as partners, as advisors, and as guides. And I'll break those down just slightly so that you understand what it means. But again, I often do come back to a couple of those colloquialisms that we can be the GPS service for you. So you're always navigating and knowing exactly where you need to be, who you need to meet, that we are an extension of any sort of HR function. So as it relates to talent, building pipeline for the future, and an extension of your marketing department. So if you want to come set up in New Brunswick, we want to make sure that the right people know about it, that job seekers know where to find the opportunities, that you've got all of the collaborations that are available to you in place. It's our job to oversee that process. So from a partnership standpoint, this really for us is, who do you need to know in New Brunswick as you begin to do business and as you grow and thrive within the province? So that would relate to things like talent acquisition, access to a pipeline of talent, knowing where the job seekers are, knowing where those who are coaching the job seekers are, building presence in all of the right areas from an HR perspective, plugging into our academic partners. So again, ensuring that you've got all of the right relationships that you need, chambers of commerce, different associations. Tandy mentioned earlier that New Brunswick is the epicenter for cybersecurity in all of Canada, and we have tight alliances with CyberNB, who is the provincial body representing all of the interests of the cybersecurity industry. Access to different types of funding that we can plug you into for attracting students, for attracting new immigrants, veterans, people with disabilities. We are within these ecosystems at all time, and it's our job to bring all of that information to you. And you can trust me when I say this is not a list that we hand to you to say, please take this and make these contacts. These are, like I said earlier, high touch, white glove service. We will be on the meetings with you. We'll facilitate the introductions. We'll help guide the conversation because we're experts in our regions. We're experts on what's available to our partners and to our businesses in New Brunswick. And that's going to be something that we move on and pass on to your organization as you come here. So really this first partners piece, how do I become part of the community, right? How do I make it so that I'm not just a business that has come from away, but by the time I land, I'm well known, I'm well networked, I'm well partnered, and able to hit the ground running. Secondarily, regional advisors. So we happen to be part of a number of groups and committees as client engagement specialists where we can advocate on your behalf. So I tend to refer to these as sort of super groups that exist from a regional perspective, but it's where we gather as many stakeholders as are required and meet on a very regular basis in order to address any concerns that our businesses are having within the province. So if these are some of the bigger issues that maybe we can't tackle on our own, if it relates to housing, public transit, and how that impacts your employees, anything having to do with the municipality, employment standards, this group would be 15, 20 people large and has the horsepower to troubleshoot any issue that comes to us from our corporate partners and from our ONB clients. And so we meet very, very regularly in order to discuss issues that bubble up through our meetings with you individuals and your companies. This is also a great place for us to reference any issues that you're having in relations to immigration. We want to be your advocates from an immigration standpoint. We have partners in-house who operate our immigration programs, but if there are things that are making that a bit more cumbersome or a bit more difficult for our clients, we can have that troubleshot at these meetings with our regional teams. And then third, we have a particular focus on international talent in New Brunswick. There's a member of my team who works specifically with international students who have selected to come from away and study in New Brunswick. It's a high priority for both our organization and for the province in general to ensure that these students find meaningful employment in New Brunswick and stay in New Brunswick. They've come here, they've studied, they've built a life for themselves over any number of years during their study. Oftentimes, they're not just coming alone, they may be coming with families. And so we want to make sure that you've got an opportunity to connect with these students so that, again, they can be part of your talent pipeline, but it's a reciprocal relationship so that we find meaningful opportunities for these students in the province in order to continue to grow our population, diversify our population, and create talent for the organizations that we're working with. So really, that's a bit of a high level of what it is that my team would do. Again, fully customizable. This is not a cookie cutter, one size fits all type of support that we offer. What this requires is several meetings to understand exactly what the needs of your organization are, your individual needs, the needs of your family as you might be immigrating to bring the business to New Brunswick. You will have an advocate and a support from my team in that regard. And then I guess a little segue from there into our lift and shift model. This is something that we've executed a number of times, but this is when we want to talk about not just moving business to New Brunswick, but moving people to New Brunswick. So we have had the privilege to work with some organizations that said, we don't want to just bring our company to New Brunswick. We want to bring 10, 15, 20 of our employees along with us to start the setup of the office in New Brunswick, and then potentially hire local talent after that. But if you have a particular culture, you have particular expertise, particular leadership that you think the company would be negatively impacted by if they stayed in your home country and did not come and be part of the initial movement in New Brunswick, we have a model in order to facilitate that as well. And again, this is all completely customizable, very high touch, so that we understand these are not just business decisions. If you decide you want to move or ask employees to move to New Brunswick to start the next phase of the organization, start the next phase of your growth, I have a complete program that we can execute. We would meet with you prior to that decision being announced internally to ensure that we've covered all of the logistics. We would then prepare a complete welcome and settlement package for any employee that would be coming to New Brunswick, ensuring that their individual needs were met. We would then present that to your organization or to the employees that potentially would be taking advantage of such a package. We've done that in the past by going and spending a day at clients' sites, doing presentations, meeting with individuals afterwards, because again, this isn't just, should I move to New Brunswick for my job? It also has to do with spousal concerns, children, families, et cetera, et cetera. How can we make sure that that decision is one that encompasses all of the perspectives that I know I would be dealing with if I went home to tell my wife that we were moving to Delhi tomorrow? I would hope to have some support on the back end to help us make that transition. So we would meet, present to the employees, and then upon agreement and upon approval from you that they would be coming, a complete welcoming and integration package, which can include everything from picking people up to the airports, to touring them around the city, to just ensuring that they are supported on their way in. And then we monitor that going forward. It's a support to the individual in the same way that we would support the organization. They need an advocate. They need someone on the ground to help them with anything that is new or different from the life that they've known before. As they help to grow the business, we will support them on that personal, family, settlement, integration side. So that's sort of what I do. My team is all about making sure that as you come into the province, whether it's you as a corporation or you as a business owner or your people as individuals, we are here to rally resources and networks, make sure that you've got everything you need to settle and grow in the province. And again, this is a relationship that is for the duration of your time with us. So from the minute you say that might be interesting to the time that you're celebrating your 10th year in New Brunswick, we're here to be your supports, to be your advocates and your partners. And with that, I think I'll hand it back to Nadira, I believe, but we certainly appreciate everyone's time and would look very forward to welcoming you to New Brunswick.
Thank you, Dan. I would have loved to take up the questions from the chat box, but Tandy, I believe you've been interacting with them. Would you want to emphasize on one of the points, which is, I think two people are wanting to know what kind of benefits or incentives are being offered to healthcare startups?
Yeah, so there's a few questions. So I think we should just talk about on the finances. So Opportunities New Brunswick, ourselves, we work with a payroll rebate. So we are looking, once you are set up and you have hired people from New Brunswick, at the end of the year, so we develop a contract about, usually we'll start with a 3-year plan. So how many people you plan on hiring, what type of salaries, and we'll develop a contract from there, and you'll get to see kind of what your payroll rebate would look like. And then each year, we would look at the T4s, and you'd get paid out that way. But every different partner that we have here works with different types of companies. So it completely depends on your business. But that would be kind of one of the things that we would look at and kind of point you into the right place. So for Opportunities New Brunswick themselves, it's a payroll rebate type that we look at.
I think there is Priya Anand who wants to know, is there an opportunity for an enterprise providing geriatric home health care?
So we have in New Brunswick right now, the way it's set up, we have long-term care homes, and some are publicly funded and some are privately funded. So what that looks like is companies would come in, some people will only own one home and some people will own multiple. So there's a certain percentage depending on the senior's salary that the government does subsidize these long-term care homes, the programs. And then there's some, I mean, as you know, everywhere in a private setting that they can upgrade and be paying themselves. So in order to kind of get into that setting, I would definitely do my research first to see what's available, what's needed. But I think that is also an area that is definitely growing because of the senior population that we have. And I've talked to different countries, and I know it is different. The amount of, you know, a lot of the places, their aging parents stay at home with them. That hasn't necessarily been the case in New Brunswick and in Canada. A lot of the time, they provide a home for their parents to make sure that they're taken care of, where there's nurses there, that they get the right medication and stuff. So we are looking to shift a little bit back to kind of keeping seniors in their home longer. But as of now, the long-term care home has kind of been what has been going on in Canada.
Tandy, there is a rather long question from Sumant Bhatoria, who has also requested to touch base with you one-on-one.
Okay.
So I assume you'll be writing to him. Sumant, unless you want to type in a shorter question and have a quick chat now, they will definitely be reaching out to you.
I was actually taking down his email address when Dan stopped. So yes, I will reach out to you via email, and maybe we can set up a time to talk further.
Okay, we have Madhu Suresh. Madhu's company is also an ICBC member, and she wants to know, we are a customized healthcare software development tech company. We are well established for the past 17 years in India. What are the opportunities for us for a partnership with research organizations in New Brunswick?
Yeah, and so that would be, I mean, it would depend on the research, but if you're interested in some of the companies that I talked about and on that slide, we can put you in contact with them. If it was the Precision Medicine Center, we do have, you know, direct contact, and you can kind of work with them there, and they work on different projects. And a lot of the time, what I've heard, they usually have an industry, they usually have, sometimes they'll get a nonprofit, and they'll get 3 or 4 partners working together on a different project, and a researcher as well. So if there's a contact with a specific program that I talked about that you want to contact, I can help you out there.
Okay, one of our own, Devrat Bhatia, an ICBC team member, he wants to know, being a port, what would you say is the percentage difference when it comes to cost of manufacturing in New Brunswick over an inland province?
Oh, over which province?
Inland province.
Okay, so what's the New Brunswick compared to other provinces in Canada?
The cost of manufacturing, the difference in the cost of manufacturing.
Yeah, so just recently we kind of put together some of those numbers. It was about 20% less on average than Toronto, and about 15% less than Montreal. So KPMG puts out that data every year, so it is available to the public to kind of look for doing business in different provinces. But just recently we did have a project, and that's kind of what those numbers came out. British Columbia, so Vancouver, would be more similar to what you'd see in Toronto, or possibly even higher.
I guess we're done with the questions. I don't see any more, and you've answered all of them. All of them are looking forward to a one-on-one with you now, Tandy. So
Okay.
we leave it to you to take it forward, and Nadira, over to you.
So no, just I think that this has been a great session and a lot of information both from you, Dan and Tandy. And I think we are already, I mean, the questions are still coming in. So if you want to quickly answer one which says, what does ICPC stand for? From Priya Anand. So if you want to quickly answer that, Tandy or Dan.
What does ICBC stand for?
ICP, was that to us? It says ICBC.
Yes, I thought as much. I think that they're trying to ask, what does ICBC? Priya, it's B for Bombay, not P. And we are the Indo-Canadian Business Chamber. That's our short form, our acronym.
Okay, so getting back that we will, we are here in case any of you want to connect further with ONB and with Dan or Tandy. And Dan and Tandy, we are here in case you want some more information on the people who have attended. Thank you very much, all of you, for attending the session. And to Dan and Tandy, we have a great partnership with ONB, value it a lot. And I'm so glad that we had this session today. All the best. Looking forward to a lot of more partnerships and collaborations.
Thank you so
We
much.
appreciate the opportunity.